Hello, this is Paul Rothenberg. I'm an orthopedic surgeon in northern New Jersey. And this is an arthroscopic capsulorrhaphy, also known as a Bankart repair, for anterior shoulder instability. Viewing from the posterior portal in the beach chair position, there's a clear tear of the anterior inferior labrum. First step is mobilization of the labral tissue using an arthroscopic elevator. An arthroscopic shaver is then used along the glenoid neck. This is to stimulate bleeding, which can be helpful for eventual healing. A ring curette is then used to expose the subchondral bone on the anterior face of the glenoid to create a better healing surface for the eventual labrum repair. Using a curved guide, my first all-suture anchor is placed low on the anterior glenoid. Using a suture passer, I take a full thickness bite of the labral tissue and I pass the repair suture in a standard fashion. The repair suture is then shuttled back into the anchor and tensioned, reducing the labrum onto the glenoid. The repair suture is then removed from the cannula and saved so it can be tensioned again at the end of the case. These steps are then repeated 3 more times for a total of 4 anchors. All the repair sutures are then retrieved through a single cannula and sequentially tensioned to get even and secure fixation. All sutures are then cut, displaying the finished repair.